We are outside the Crown Gardens Clinic in Johannesburg. That is where we got reports that there was a scuffle between foreign nationals and the South Africans. The scuffle is about the excess of medication inside here. But let us introduce those who are involved. Thank you very much, my sister, for your time. You can just tell us what transpired, what happened today.
Oh, okay. My name is Ponso from March and March. Yeah, Tina siyi organization elwa nabantu bokufika ezweni lethu. So since we started this thing, I think it's about 2 months now. But today morning, I was at home, and then the people that who were here at the gate, they call us. They say back up. When you arrive here, there's a lot of police here outside. They are forcing those foreigners to enter here at the clinic. So Tina masimela at clinic city Tina, we don't want any illegal we don't want any foreigners. It's legal or legal or illegal. We don't want them to get a health service here because our facilities are limited. We are trying to protect our facilities because now even amanesi wethu sebenza under pressure.
We have to also introduce a foreign national who wants to also add on what is happening here. Boy, thank you very much for your time. You are saying you are coming from
I'm coming from Bangladesh. From 2005 I'm here.
Okay, so now with this issue of illegal foreigners coming in here to access health services in South Africa, as a person who is not from South Africa, your reaction on that?
Healthcare, what I know, whole world is free, legally or illegally, as long somebody in there. You guys need to you follow the border guard. How do they come in? That is must be strong. Now whoever they're in, supposed to be they get healthcare. That I want to say, as a human being.
So you are saying whether you are in South Africa legally or illegally, you must have.
My point, illegal is you guys' fault. How do they come illegally in the country? Where is the border management? Where is the border guard? Where is everybody? That is you guys now failing that way.
And you'll take advantage.
So you can tell me that do you think what they are doing here, blocking foreigners to access services, is fair?
That is I not accept it. If you go like another country, South African local people also whole in the world everywhere. So if you go to another country, if they treat you like that, how you guys feel? It's same way us also you feel.
Thank you very much for your time. This gentleman is from Bangladesh. He's telling SABC News that what is happening here is unfair, especially for those foreign nationals, saying that if you are coming from outside the country, once you are inside, you must have access to services. There is a pensioner that is telling us that he has been coming here to access services and unfortunately he is affected. Thank you very much for your time. You can tell us the squabble that has been taking place here between South Africans and foreign nationals.
We should be put first before the foreigners. Everything else before the foreigners. This is why places like this are overcrowded. And then we get left behind. We are entitled to everything first. Foreigners must go back home and go to their own hospital. Right?
For some time, it's been a month, and we're just going to see if he's able to get into the clinic or not. Just the processes that often happen here.
How are you?
I don't have ID.
You don't have an ID?
Yes.
Passport with your medical certificate to show that you can enter?
I got certificate.
Medical certificate?
No, medical certificate I don't have.
No, we cannot.
Who are you?
I'm a South African standing up for my rights. As the Constitution, Section 21 says, if you do know our Constitution, because as you are a foreigner in our country, you should be able to know the Constitution of South Africa, the don't-dos and the do's of what you must do in the country.
Okay, thank you. I come to the hospital. I got appointment for 1 month's kid.
Are you a South African?
No.
This is the public hospital. It serves South Africans.
I come from East Africa. I'm not foreigner.
You are a South. Okay, fine. Let's
I'm not
your
foreigner.
ID.
I'm from East Africa.
East Africa.
Yes.
Okay, fine. Listen.
I come from Ethiopia.
Okay, you come from Ethiopia.
Yes.
Ethiopia. It's not South Africa. This is South Africa with its own laws. And South Africa, it's for South Africans. East Ethiopia, it's for East Ethiopians. This is South Africa.
Let me tell you, me, I stay here, South Africa, is 18 years.
So you still don't have papers?
I'm using the asylum.
You are still a illegal foreigner. 18 years with asylum.
Yes,
that's questionable.
Yes, that is not my problem.
That is questionable.
Me, I living with the asylum.
It's questionable.
I don't have the ID. That is my problem.
For the resources of South Africa, talk to us essentially about, so far now, it's been at least almost 2 months of this campaign. Just the reaction that you've been getting from some of the residents on the ground.
No, like foreign nationals, they are fighting us. They told us straight that they will fight back because they also deserve to have access to these healthcare facilities. But we are still standing here. It's almost 2 months now. We are not going anywhere. If it needs them to fight, then they should bring it on because we're protecting our resources. It's too much now.
Rabile, if you would allow me just to speak to a gentleman here earlier who was denied access to get his chronic medication. Thank you so much. You live on Newsroom Africa. Just show me just the documentation you have and walk me through what happened this morning when you approached the clinic gates.
I come because I am legally in South Africa and I got permanent residence and ID because it's written from Zaire and non-citizen. They refuse for me to access the medication.
And how long have you been without your medication? And you know, how are you starting to feel in terms of your health?
You say?
How long have you been without your medication, and how has it been in terms of your health?
No, I'm okay. My appointment was today. I was supposed to collect today for next 3 months, and they say it's only for South African.